Are we really addressing the mental health crisis or just masking the symptoms? We keep hearing about the importance of mental health awareness and trauma-informed care. But what if all this support is just a distraction from the real issue? The truth is we're treating symptoms, not causes. Our mental health crisis isn't an internal flaw within individuals, it's the result of broken, unjust systems that keep people in a state of constant trauma. Even the trauma-informed trend frames trauma as an individual issue, rather than acknowledging that it stems from oppressive environments. Here's the problem with this approach. 1. It treats symptoms, not causes. Diagnosing individuals with disorders ignores the reality that their pain is a rational response to abusive systems. We need to fix the societal structures that are causing this suffering, not just manage the symptoms. 2. It gives a free pass to perpetrators and a life sentence to their victims. While victims are bombarded with support services, the systemic abuses that cause their trauma go unchallenged. We end up treating individuals as broken, while letting the real culprits off the hook. 3. It creates an illusion of progress. Mental health awareness campaigns make us feel like we're addressing the problem. But without systemic change, we're stuck in a cycle of therapy and medications that never touch the root of the issue. Real healing won't come from more therapy or awareness campaigns. It will only come when we change the systems causing trauma in the first place. As we head into the weekend, let's ask ourselves, are we content with this illusion of progress? Or are we ready to face the truth of what a real change demands of each of us?